Attendees are currently in listen-only mode and your mics and cameras are turned off. Today's presentation is available in the handout section. Click here if you see the paper, click to download the presentation. If you have a question you would like us to read and answer, click here where you can see the question mark to add your question. If you would like to ask a question during our comment section, please click this button to raise your hand. We will invite you to unmute during our public comment section for today's presentation. Before beginning our meeting, we would like to ensure civility for all of our meetings. Free expression of diverse viewpoints is a fundamental value of our group. This freedom carries a responsibility to engage respectfully, which means treating one another with dignity and respect and good faith. Uncivil behavior, disruptive conduct, abusive language, threats, or harassment will not be tolerated and may lead to being excused from the meeting. Thank you for helping us keep this a productive and comfortable meeting for everyone. And I'd like to turn it over to our Director of Federal Programs, Rhonda Workman.
Thank you, Eric, and welcome everybody. My name is Rhonda Workman. I'm the Director of Federal Programs. I'm one of the co-chairs for the Waiver Advisory Council. And I'd like to now invite Charlotte, who is able to join us online, to introduce herself. Charlotte, are you able to hear us?
Okay. Hello, can you hear me?
Yes, we can, Charlotte.
Okay, excellent, thank you. Yes, my name is Charlotte Fregna Whitaker. I am a participant of the Self-Directed Services and a co-chair on the Waiver Advisory Council.
Great, thank you so much. We have Robert White, our Chief Operating Officer, who will be joining us in a minute. He was called to another meeting, so he'll be joining us in a few minutes. Eric, I see in the chat that someone's noting our presentation in the handouts is the October 16th meeting, so thank you for alerting us. We'll take a look at that and make sure that today's presentation is in there. So thank you for sharing that. Can we go to the next slide, please? So we just did our welcoming. Let's go to the next one here. So here's our agenda for today. We just went through the welcome. We are going to talk about the council purpose, guiding principles, roles, and the ground rules. We want to review those because with the legislation that was passed, with the statute, there are some additional elements related to that. We will then seek the approval of the October meeting minutes. There will be a variety of DDA updates, and then we want to have some great dialogue and discussions. We got some questions and things that we'd like to seek some information from the council. Then we will also go through our work group updates and have discussions related to that, share some additional resources, and we have resources throughout the presentation, and then open it up for public comment. We know that we've shared information, I believe it was yesterday, related to some of the handouts, and we want to make sure the council has additional time to look at those. So today we're just going to be talking about some of those things and then, further discuss those as we go forward. We are working really hard to try to make sure that we can get that information out ahead of time. So look for information to be provided even sooner as we continue to go forward. All right, welcome, Dominique. Okay, so we can go to the next slide there. So we wanted to talk about the council's purpose, some of our guiding principles, the roles, and the ground rules. So if you can go to the next slide. In our presentations and going forward, you may recall in our last meeting, we had asked what additional supports and information that would be helpful for the council. And one of the feedbacks and discussions that we had was really talking about the why. Why are we talking about these things to kind of help to make sure that we're all on the same page. And so this slide talks about why we're talking about the council's purpose, roles, and guiding principles. And this is so it can help to remind everyone why the council exists and what we're trying to do. The guiding principles explain the values and the way that we'll be working. The statute talks about person-centered thinking, equity, and inclusion and diversity. So we want to make sure that we review that and make sure we're thinking about that as we do our work. The roles help to clarify what our job is, and such as giving advice and making recommendations to the DDA, and then what it's not. And then the ground rules, those help to set our clear expectations about how members will act during the meetings so that everyone feels heard and respected. So that's the why we're talking about this topic. We go to the next slide, please. So here's our council purpose, and you have that on the screen, and we also have handouts here in the room for individuals. The legislation and the statute that was passed specifically states that this council's purpose is to provide advice and provide recommendations to the DDA on system design, service delivery, and quality enhancement strategies for the DDA operated waiver program. It also states under the section for purpose is to foster meaningful engagement and establish a feedback loop with all stakeholders while prioritizing input from people with lived experiences with the Medicaid waiver program. And on the slide, we include the link to the actual legislation if anybody would like to look at that. Next slide, please. The statute also establishes the guiding principles, and it notes that this council shall adhere to person-centered thinking, diversity, equity, and inclusion principles, and evidence-based and data-driven discussions and problem solving. So this means we should be listening to what people want for their lives. We value and respect diversity, equity, and inclusion. And we should be making decisions and solving problems using facts, data, and proven practices. Next slide, please. The statute outlines our role. And so there were 2 additional ones from our initial charter that we were working under. So what continues is the advice and recommendations related to the DDA operated Medicaid waiver program system design, the service delivery and access to services, the federal waiver assurances, ensuring access to Medicaid services, also referred to as the federal Medicaid access rule, quality enhancement and improvement strategies, and then the statute added 2 additional ones that was not in our initial charter, which was communication with stakeholders and collaborative processes with stakeholders. This means that the council job is to give us information, ideals, and guidance to the DDA. The council can suggest these ideals and get feedback. The council is in an advisory role and making recommendations to the DDA, and that the final decision is with the state. But we're really looking for great advice and recommendation on these areas that are noted in our statute and our purpose. Next slide, please. For the voting, the statute also outlines voting related to the advice and recommendation that would be going to the DDA. It notes that the council will vote on the advice and recommendation it gives. The council will try to reach an agreement before voting, and everyone should have the chance to share their views and have their voice heard. And remember, the statute outlines that really we need to be supporting input and information from people with lived experiences, and that a decision is made when at least 75% of the members agree that that advice and recommendation should go to the DDA. And each member, each voting member gets a vote, and it would be either that member or their proxy. Next slide, please. I'm going to turn it over to Charlotte. She's going to review our ground rules that we have for each meeting.
So the ground rules for the council are as follows. We are to assume positive intent, speak one at a time to allow everyone to be heard, using plain language so that everyone can understand, share information openly so that we can all learn, listen to different points of view, stay flexible and open-minded, participating actively so that everyone's opinions are shared and everyone hears them, engage respectfully and politely, and to minimize distractions to allow everyone to hear.
Thank you, Charlotte. Can we go to the next slide, please? So we're going to open up for discussions and questions. The Waiver Advisory Council Charter has been updated. There's a copy in your packet if you're in the room today. That's also been uploaded on the DDA Waiver Advisory Council webpage in the resource section. So you'll see the addition of the new members that we have, which includes expansion with Service Coordination Inc., MAX, and the ARC Maryland. It also expands with additional family member representation and the addition of a support broker. So you'll see that information in there. The additional purposes are noted in here, and that we've added a requirement for council members to attend 50% of the meetings so that we make sure we have active participation. So that is available on our website. We are also updating the council's website related to the information so that it can align with the statute and changes. We're taking down the previous application that we had on there because now we have to go through the appointments application process. So we'll be continuing to provide updates on the website. So Charlotte, I believe we want to now open it up for discussions and questions if you wanted to facilitate that.
Yeah, well, the discussions are now open to so far what we have heard so far in regards to the why, the purpose, and the changes. So if anyone would like to bring up any comments or questions.
I have a question.
Yeah. So we have Robin, if we could just, because we have a lot of people online, is when we call in, you can just introduce yourself so that our council members will know online who's.
Sure. This is Rob Baynard from Opportunities Incorporated, DDA licensed provider. I was curious about just kind of how this group intersects with some of the other larger groups like the RRAG and the MidSec, because I feel like a lot of the work that we would be looking at would somehow be tied to those things. And so in the interest of ensuring that we're not wasting our time looking at something or spending time in an area that we shouldn't, it might be good for us to find a way so that anything that comes out of those meetings we can work within. Does that make sense?
Sure, absolutely. And so just for everybody's awareness, because we have different people and we may not all know what we're talking about in terms of other groups. The DDA has other advisory groups that provides information, advice, and recommendations to the DDA. That includes the Rate Review Advisory Group. We sometimes call this RRAG. And so that group really provides input and recommendations related to the rates. And some of that's related to some of the policies. There's another group that's been established that's been meeting, and that group is related to the Maryland Intellectual and Developmental Disabilities Sustainability and Equity Committee. And that group has been meeting and looking at strategies and recommendations to the DDA related to equity and sustainability of the programs. And so those groups, as they meet and as information comes up that relates to the service delivery design and policies and the things that we have within the scope of this council, that would be brought to this group so that this group could look at and provide advice and recommendations related to that. So that's how I think it's going to feed into this group. And so those things would be coming. Other questions? Charlotte.
Yes, there was actually some discussion that occurred at our lived experience group that we were gonna bring up during the update, but since it's coming up now in the beginning, the mentioning in the charter of the prioritizing input from people with lived experience. We discussed that, our lived experience group, and we actually do not agree that the council prioritizes the input from the members with lived experience. And since it was pointed out, we would like to ensure that it does become the priority as it states, and that we feel that it is our input is the priority of this council.
Great. Any discussions from the council member?
Charlotte, this is Karen Lee. You and I have kind of had this conversation before, and I'm wondering if there is an indicator from you or some sort of more specific way of identifying when you believe that you feel you're being heard, so that it can more easily be identified that equity is happening. Are there some specific behaviors or some specific role, or is there anything a little bit more specific that may help to identify what it looks like when it's working that way?
Yes, definitely. I mean, the specific is kind of just in the manner in which this council exists. I mean, I don't think that the input has had, like, even in what we discuss, we're not discussing the input from people with lived experiences. We're discussing the input generally from LTSS or National Core Indicators or Medicaid or DDA. That's our discussions are not focused on what we're saying. We sent in a letter to DDA stating things that we thought were important and that we were concerned about. And we were told that that letter was not in the purview of this council. And that confused us because it is input from members with lived experience. Therefore, it should be prioritized despite what any other member or DDA believes about that input. Our input was prioritized, and for it not to be shared feels wrong.
Other discussions? We've got Andy and then Josh.
Hi, this is Andy. I'm sorry, can you all hear me?
Yes, we can.
Okay, great. I just wanted to say, Charlotte, I hear you, and as a fly on the wall for, several months, sitting in the back of the room, kind of watching the Waiver Advisory Council, I'd agree to you that I agree with you. It does not appear that the voice of people with lived experience has been prioritized. And that message is sort of evident in the lack of and I'm not saying this is a DDA thing. I think this is an all of us thing. The lack of concerted effort to ensure that people with disabilities' voices are truly heard and that the format's accessible for people and there's adequate time given to consider everything that we're going to talk about for everybody ahead of time. And so I think we could all do better and agree that that's the direction we need to go in, that people with lived experience should be the priority.
Thank you, Andy. Josh, you had your hand up. Did you want to share something? Josh, are you able to unmute yourself and share your thoughts? Josh, we'll come back to you.
I'm sorry, Wanda. I couldn't unmute myself, but can you all hear me?
Yes, we can, Josh, go ahead.
Thank you for your patience, and I apologize if I sound stuffy. I have a cold, but anyway, I do apologize. But I think Andy actually hit the nail on the head, and she basically said some of the things that I was gonna say anyway, and that is, I feel like we're not being heard, and I feel like we don't have a lot of time to go through some of the material that is given to us still. And so those are the things I wanted to bring up that I feel need to be addressed. Wanda, thank you.
Thank you. Great. Karen?
So, because I think this keeps coming up in a lot of environments, I'd like to not move away for it for a second and have a dialogue about it. So rather than just people giving input, to have some dialogue. And Charlotte, I think one of the things that I've heard in the Waiver Advisory Committee subgroup that you and I are in together is when we're talking policy level, or we're talking, like you said, about how something is written, or that might not impact people, that we're missing kind of the core of tell me what this feels like when it's actually put into place, right? So that there is a way to change how you approach the critical information here that's at the implementation level rather than at a policy level. So rather than starting at the policy level at a discussion, this is what CMS requires, or this is the way LTSS works, or all of that, you start at the service level. So you say, what does this look like for people who experience this? So let's say we're talking about CDS. What does it look like when people with lived experience have to hire a staff, let's say for personal supports? What does that look like? How does that impact them? So that we talk about the services at the service level and then go up to the policy level, or go to the policy level. So rather than starting at the policy level, which is not necessarily how people with lived experience experience the waiver advisory, right? They experience it in their day-to-day lives. And so it may mean how we create the agenda and how we run the meeting starts with how people experience whatever it is we're talking about that day. And then we move to okay, so how would you write a policy that relates to that? Or does that align with the federal definition? Or how does that get paid for, or whatever? But that you start the discussion, it's kind of like employment first, in that you're supposed to be talking about, before you talk about any other service, even residential, even personal support, anything, you're supposed to say, let's talk about work. And then from there, you say, okay, that should influence how your budget is created, and that should influence all. And so, Charlotte, I'm trying to take a stab at giving us, and Josh, I'm trying to take a stab at how we could actually change the agenda and the items that are on the agenda to start with the perspective of how things happen and how it's experienced by people with lived experience, and then move from there. So rather than starting at the policy level, we start at the experiential level. Would that is that a solid way of making that kind of a shift?
Personally, I'm sorry, I didn't raise my hand. This is Charlotte speaking again. I personally think that is definitely the direction we should be going, because in terms of the experience, we are the experts. And what I feel like I haven't witnessed is instances where we are receiving questions about these things. You know, I feel like so much of the people with lived experience, so much of our responsibility is to formulate our input for you guys to understand. Like we have to accommodate our experiences so that it can be viewed and heard in this setting. And what is disappointing is so often it is the responsibility, it falls upon the people with developmental disabilities or with the need for accommodations to figure out how to say the things they need, how to. And I think what we need to start seeing is the other side meeting us halfway. And I think so far I've seen in a lot of these programs, not specific to DDA or this council, is an inability for people that are working within the system who are able-bodied to formulate the questions they need to ask us. They don't know what they need to even find out, so they're asking us to bring everything. And so I think seeing that shift towards these entities like DDA or these social programs, knowing more about people with lived experiences so that they can direct more the kind of input they're asking from us, because they're giving us no idea of what they want, and then we give it to them and they say, nope, that's not the right input, that's not what we're looking for. And we're left to think, well, didn't you ask us here because we know? Didn't you ask us here because of our expertise? So why are we now being told that this is not the input? And so I think the moving towards the experience is how we avoid issues like the one that happened on October 6th, when we implemented a amendment that should not have been implemented. We said services were going to not be accessible. We told them that, and services became inaccessible. And unfortunately, even if, you know, we all rushed to repair the problem, when people with developmental disabilities cannot access their services and they cannot live their lives out in the community, they're the face of that failure. The general public sees a person with disabilities unable to come to work, to be relied on. And it hurts the way people see us. It hurts the incorrect stigma that people with developmental disabilities have out in the world, and we need to be careful and make sure that we do not put out amendments that our council felt was not ready. And we don't do that to our community again, because it's harmful and we're not here for that. So
Great. Thank you. So down here is a question. Yes, Martin.
Martin Baker, I'm representing self-directed program here from the council. I listened to this impassioned plea here from Charlotte, and I just have one short thing to say. This is the co-chair of the Waiver Advisory Council. I rest my case. That's all I have to say. I think it demands that we pause and reflect on what she said. The fact that she went on at such length, and this was not tedious stuff. This was our daily lives are heavily impacted by people not being able to access services. They can grind to a halt. We can't just stop and say thank you for your input now. See you at the next meeting. So this is a co-chair, with Rhonda. I don't have a solution, but I think we need to really address this now.
So I think really great discussions. I know we will take that back. from that perspective. As the statute says, we really need to, the council's purpose is for the advice and recommendations, and we need to prioritize people with lived experiences. The original charter that the DDA put out prior to the statute had that we were prioritizing people with lived experiences by having a majority of membership being people with lived experiences. I do not believe that was continued in the statute, unfortunately, and the membership shifted so that now there's 50% representation versus the majority being people with lived experiences. But I think, as Charlotte has said and others have said, that all of us as council members have a role and a responsibility as per the guiding principles that are in the statute to use person-centered thinking and to prioritize input from people with lived experiences. So as we go forth and we can look at the agenda and how the meetings go forward, we need to, in any of our discussions, any of our subgroups, we need to make sure that we're first asking people with lived experiences their input, their advice and recommendations, so that that can then be brought to the council, and then the vote can occur as per the statute requires, so that we can make sure that we are getting those recommendations and prioritizing people with lived experiences, while also as council members getting input from who you represent, so that you bring that to the council too.
Brenda, if I could, this is Karen and Charlotte, because I've spent a lot of my career sitting in meetings like this. Let me toss something out as an idea, kind of to pass on what Rhonda did. I don't know what Marianne where she's going to talk about specifically, but I do see pictures I recognize from Life Course framework. So I think listening to what Charlotte said is that if there is a short presentation on Life Course, and then we stop, and then we say, for the people with lived experience, can you tell us about your experience with this tool? Can you give us input about how you use this tool, or how it has been helpful, or how you would like to see it integrated into our day-to-day work? And I certainly think we need to do some preemptive work before we come to this meeting so that people are prepared to speak about it. And that the first, after a presentation of an area, of a specific, this is what we want to talk about, we stop and we hear about the life experience of people using whatever it is, the tool or whatever it is. And then there has to be dialogue. It can't be we run into a vote. There has to be dialogue about, okay, how do we use that information from which they did to create policy, or to recommend policy, or to create a pathway forward. And then the vote happens, well, can we do it? But that after a short presentation, which people with lived experience should already have that information ahead of time, so that they can be prepared to share their experiences about it before we move into how that translated to policy. Does that, Charlotte, do you think that would give the venue for people with disabilities to share as the first dialogue before we figure out how to implement it, or to scale it, or to tweak it, or whatever it has to happen?
Yeah, and I do feel like this is kind of the first time we're in these settings, so I think trying different things is a great idea, because we need to see how it works. We need to see how our members take to the strategies, because it's new. And so I have confidence that we can do it. Once I see it happening, that's when I'll really be able to kind of give my opinions and ideas about it. But I think if we just switch these attitudes that we all kind of have about this much larger system than any of us are, but that really deeply affects so many intricate parts and areas of our life. And And I think if we all start recognizing the different areas that don't seem to match up, like telling us that the purpose of, the waiver is to allow members or people with developmental disabilities to engage with their communities and to, I'm sorry, I had so many thoughts, I lost that. But the focus needs to be the people with lived experiences. And I think meeting us where we are in our experience of this waiver is what we have to move towards, what we have to push towards, because we knew the amendment was not going to work out. And it didn't, and people lost services. And so I think I think what we said when we were in the discussion is the difference between listening and hearing us. And so I think if we move towards that, if we kind of change the sort of attitudes and recognize what we're talking about, because people with developmental disabilities on this council or on this waiver are seen differently in the public. They're treated differently by the government. And we're also telling those people that they have just as many rights as everybody else, and yet we don't see that. And so I think this council needs to kind of at least be that start, be the front lines of people with developmental disabilities, seeing people treat us respectfully and as though we are first-class citizens.
Thank you so much. So I think we appreciate all the advice and discussion. What some of the things I've been hearing is to ensure the discussion after each section, to be asking people with lived experiences to share or tell how this topic or the information being shared relates to them and their life story, and how that could potentially influence policy and things like that. So I think that as council members, those are things that when we get to the discussion section, we can, as members, help to support that, encourage that. I know we have a lot of really great information today that we'd like to share related to a variety of updates. And so I'd like to continue with the additional information so that we can have some dialogue and discussions related to that. But we will take back the advice from the council that's been shared so that we can see how we can further support. But I want to encourage all council members to be present in the meeting. I know there's a lot of distractions and things we've got going on at home or other work engagements, but hope that everybody can, share and be active participants in the meeting, and to help to support getting the voices of people with lived experiences. So
Rhonda,
can we go to the
Rhonda, it's Laura. I've had my hand up for a while, so I'm present in the meeting and trying to participate, and having a little trouble.
Sorry,
here,
Laura,
so.
I didn't see your hand. Please go ahead.
Okay. Just real quick, because I know we've talked a lot about this, but I just want to say, first of all, I don't think the passage of the bill affected what I hear Charlotte saying, whether it's 50% or 51% or 60%. But I just want to say, I think I hear two things. One is we as council members have to make this commitment. I would certainly hope we all have done that in terms of prioritizing the voices of people with lived experience. What I think I hear Charlotte saying is where it gets lost is that input being taken in by DDA. And I'm not going to say we should make an official motion, but I do think it should be noted. I'm going to assume that the whole council wants to make that recommendation back to DDA, that we have to figure out, because I heard, again, I'm not explaining what Charlotte's saying. I'm just saying what I heard her say. I heard her say, we've given input and we've been told thanks, but no thanks. And I have no idea. I wasn't involved in it, but I just think that the way that the voices of people with lived experience and the way that the Waiver Advisory Council makes recommendations and being able to have dialogue is really important, because I think sometimes we say things and the response is, thanks for the input, moving on, as opposed to, thanks for the input, let's take a few minutes to have a discussion about it. So I think any of us feel more heard when there's actually a little more discussion and engagement. So that would be my recommendation.
Great. We have Abraham, and then we'll go to Beth in the room.
Good afternoon, can you hear me?
Yes, Abraham, thank you for joining us. Go ahead.
I think more people, like participants to join so they can, get their voice and opinion heard.
Thank you, Abraham. Beth?
I was just going to add to kind of a point made, and so I wonder if there's a place in our meeting to begin with what we're hearing from the community and people with lived experiences about decisions that we've already made. Because a lot of times it's as if a decision can't be undone once a change has been made. And if we're hearing that something that we have put forward and DDA has voted on has been harmful in some way to the very people that we're trying to serve, then we should do something about that as well. And so giving Charlotte and people with lived experience an opportunity to tell us when things are not working is very important. And so just raising that as maybe a way that we start our meetings is some of that honest and open feedback at the beginning. So just up there.
Great. Yeah, we do have some updates about some of the information that was shared last meeting related to experiences that we'd like to share with you today. Okay. Let's go to the next.
I have just one kind of final thought on this.
Sure.
I think this is Rob Boehner from Opportunities again. I think we all need to recognize that the last year has been a significant challenge on all sides of waiver services, for recipients, for providers, for those in self-directed, and the state. And those challenges will continue. But I think the most important thing that council members need is communication and transparency about what we're doing, so that, or the recommendations that we want to put forth, so that we understand the limitations that the state has. Because I think you mentioned at the beginning, the state has the final decision on everything. And I understand that, but I think we just need to understand the why behind decisions. And because then we won't feel like, or people with lived experiences won't feel like their voices aren't heard. That's a big piece to it. It's just that transparency piece.
Okay, let's go to the next slide. Charlotte?
Okay, sorry about that. Okay, this is Charlotte. I would like to ask if anyone would like to amend or change the October meeting minutes. If there are no amendments or changes, would anyone like to vote to approve the October meeting minutes?
I'll make a motion to approve.
I second.
Fantastic. The October meeting minutes were, and we still have to wait for a quorum to make sure. But
We're good, Charlotte.
Great, thank you.
We go to the next slide. So we're gonna do some of the updates, information. We'll try to go through some of these, different people will be sharing. So if we go to the next slide, Nicole Williams is gonna share an update related to membership updates. So you can go to the next slide, Eric. I can do the why. So why are we talking about membership updates? It's important so that we make sure we're reminding all our members about the requirements, specifically about the appointments application due to it becoming formalized in statute, to share information about our current council membership and to get recommendations and strategies related to recruitment. You go to the next slide.
Hi, everybody. So thank you for those who have already completed your application. Continuous emails will go out to everybody on the council. If you want to maintain your membership within the council, it is required for the completion of the application on the Office of Appointments and Executive Nominations to be completed. The link is here on the slideshow. I am available for any assistance to complete that if you exhibit any problems or anything. When you go to the link, make sure you scroll down and find DDA within that link and then find the appropriate seat. Again, if you have any issues, please reach out to me for all of that. Go to the next slide. So again, within the council, we have some current vacancies. So we're still seeking participants with lived experiences within the community provider managed delivery model. We're looking for coordination of community services provider, support broker, and family members within the self-direction model and the community provider managed service delivery model.
And just to kind of add to that, we've had some prior members that have decided not to continue. One of our family members has decided to join a local advisory committee and wanted to be very focused on that. And one of our coordinators of community services representative also didn't feel that she was able to provide the amount of support and time with it, and has also decided not to continue.
There are people who previously applied that were not accepted, or would they, how would you take them into consideration, or would you not?
Sure, absolutely. So as Nicole mentioned, the appointments application is available online. We put that in there. So if there are any of those categories, they can submit their application for consideration.
Sorry, I was just a clarifying question because I think it might have been around the time of the last meeting or right before the last meeting, we all, or maybe shortly after, we all received emails about reapplying or resubmitting. Do we have to do that again through this? Just clarifying that we have to go through that link and
Yes.
do that again.
If you've already completed the link with the Office of Appointments and Executive Nominations, it was like a formal application. It was not the smart sheet that you may have utilized with DDA previously, then that is required for you to complete.
I did. So good.
But why does it, I have a question, I'm sorry. It's Rachel from the council. Why does it have to go through the governor's appointments office? The law just says the secretary shall appoint.
It's going through the Maryland Department of Health appointments office. And so you want to share a little bit more about the applications that's been received and what the next steps are?
Sure. So currently the applications that have been received, the Office of Appointments and Executive Nominations does the vetting process. So I got a recent update as of this morning that some vetting has been completed, and therefore she will send the application and everything to the secretary, and she will do a final appointment in which you will receive an email with all of the formal documents for if you are officially appointed.
And so this appointments office we're talking about is not the governor's appointments office. This is the Maryland Department of Health appointments office. That's this form that's it's all through that formalized process, which is used for all councils and things that are in statute and boards. So that's why it's going through that.
I anticipate the question, like, what are they vetting for? You know, if we go out and when it's, I'm sorry, it's Patty Saylor with SDN. If we go out and we say to individuals with lived experience or their families, like, you know, apply, and then they run into this more official looking application, they want to know, like, what are they involving themselves in? So what is the vetting for?
Right. Well, I think I'm not the appointments person nor the vetting person, but I think that the department would want to make sure that anybody that got appointed to the council to know a little bit about the person, their resume, their character, those type of things. So I think that that's what they're looking at, and, from that perspective, Nicole is available to assist anybody that has questions related to the application, and we can help with that. But it goes just as it does for any of the boards and councils, would go through the Maryland Department of Health process. Yes, Rachel.
Nicole, given there's so many questions about whether people have done it, do you have a list that you could?
I do. If you have any questions, feel free to reach out to me. If you have not completed it, we have not received a response at all. You will get emails from me as just reminders. Other than that, you should be good.
If you haven't received an email recently from Nicole, that means we probably already have it. She's already been doing the outreach. You want to go to the next slide?
Operating as unofficial members.
Charlotte, did you want to facilitate the discussions and questions?
I can absolutely help out with that. This particular slide is in regards to the recruitment strategies and current ways we plan to share information about council recruitment include the DDA connection newsletter, the DDA Facebook, help from council members to spread the word, help from ethnic advocacy groups to spread the word. And the question stated is, do you have any other ideas or recommendations for how we could reach more people and encourage them to apply?
Can I recommend that Andy's on, and there's probably a partners in policymaking roster from years past. If we could send it out to people who were partners in policymaking graduates from the past.
Yeah, that's a great idea. We did, working with Rachel, we did coordinate with Andy and had a people with lived experience meeting, both a virtual and an in-person one, to talk about the amendment and get, input from them. As a result, we do have at least one of the persons, oh, actually two, because Dominique had attended and we recruited her. And we have another person that was in attendance to that, and he just completed the application. So we would absolutely love and to partner with Andy related to sharing that in plain language so that people would further understand the council and are available to help partner with that. Josh.
Could I share my that information with my own self-advocacy group to see if there are other members that might want to join?
Absolutely. That's exactly what we were hoping, that council members would help us to get the word out and help us with the recruitment. And absolutely looking for people with lived experiences.
Okay, thank you, Rhonda.
Hi, this is Charlotte Frieder-Whitaker. I want to mention that I've spoken with some CCS and people that have that they work with, that they believe they're good, that they didn't know about the vacancies and they didn't know how to let their participants know. And so I think spreading the word through those kinds of individuals like support brokers and CCS, because they're the ones that are kind of on the ground, seeing these people, talking to them, having relationships with them, they're going to have a better idea of saying who they know that would be good for it so that they can talk to them specifically.
Yeah, that's great, and absolutely want to support that. We have put it in the next DDA newsletter, the connections that will go out to our CCS's, support brokers, and all stakeholders sharing the recruitment. We have Andy that's online that would like to share.
Yeah, hi, thank you. We can have Dominique Palmer put it in her self-advocacy coordination newsletter that goes out to the empowering partners groups, and so that should reach a lot of people. So Josh's group is one of those.
Great. Dominique, or anything you want to share?
No, I'm just excited and ready to go.
All right. Thank you so much. We appreciate all that support. Great. Let's go to the next topic. So the next topic relates to the DDA operated Medicaid waiver service design. And I know that Karen Lee has shared some information related to that, and I think Rob also related to that. So if we go to the next slide. Let's talk about why the council is talking about the Medicaid waiver service design or system design. It's in our charter, it's in the statute, so that we can make sure that we're meeting people's needs, that we're following those federal rules and protecting health and welfare, that we're using public funds wisely and provide fair and consistent services across Maryland, to identify barriers, improve experiences for people and families, and ensure that the system can adapt as needs and requirements change. You can go to the next slide. So what we have done is we've put together, we've shared this in the email, but we've also have a copy here. We pulled out from the large public summary document those items that were flagged for further stakeholder input. And so it's been kind of organized based on services for Appendix C. So you can see the various ones related to that. And then it includes some additional things related to some of the additional appendices. So that can be looked at with the waiver recommendation work group. On this slide, it also includes the actual public input summary document. And we have heard today from different council members in terms of their thoughts and opinions related to the amendment and information in it. A few meetings ago, the council had proposed, or I should say the waiver recommendation work group asked a question to the DDA related to exploring further strategies related to people with dual diagnosis and looking at those things. And at that time, the ask was to really go back and look at the recommendations from the public input so that we could be respectful of those and take a look at that. So this is a list of some of those recommendations for consideration for the waiver recommendation group. Can you go to the next slide? We did get an email from the waiver recommendation work group, one of the members from that included some questions on a variety of topics that we go through for the DDA updates. So today you're going to hear updates related to some of those questions, but specific to the waiver recommendations and the purpose of that work group, there were two things that we saw from there. The recommendation was to conduct an assessment of recent waiver amendments and also to identify a new assessment tool to determine individual support needs, which was something that was put in the public input section of the waiver amendment. You go to the next slide, please, Erin. This is a resource slide. This is just the link to the actual Community Pathways waiver, so people could look at that in terms of that. And then if we can go to the next slide, we wanted to open it up for discussions and questions. Charlotte, did you want to facilitate this?
Sure. Discussion and questions. The first one, public input priorities. Are there any additional topics or themes you think the DDA should focus on in terms of amendment impact areas? What areas of the waiver amendment do you think will have the biggest impact and should be prioritized for reviewing or monitoring? And then assessment tools. Are there any individual support assessment tools or approaches you recommend the DDA consider using or exploring?
Great. So I'd like to ask first people with lived experiences, as Karen, if they had any information they'd like to share related to their experiences and any topics that they think that the council work group should be looking at in terms of the public input. Again, as I shared, we know that this information and this kind of shorter version that we pulled out, it will need more time to look at and consider, but thought we could start a little bit of the dialogue today and discussions to see if there was anything else that stuck out from people that should be considered. So that would be priority areas for possible future amendments, impact areas to assess as per the recommendation, and then any discussion or suggestions, recommendations related to individualized support assessment tools. Abraham.
I think they should focus on maybe like the transportation, for people who maybe can't walk or are blind.
Thank you, Abraham. Other thoughts from people with lived experiences or council members related to maybe topics or themes to focus on, assessment areas to prioritize for review, and assessment tools for identifying individual support needs?
Yes,
and again, we
is...
know.
Oh.
Go ahead, Charlotte.
No, yes, I just wanted to, I raised my hand, I just wanted to say something. I second what Abe said. I feel that the transportation services that got affected in the amendment are, in my opinion, very essential for members to, or for people with developmental disabilities to engage with their community. They need to have a clean, easy access to transportation. That is very important. So the transportation services, we need to ensure that there's an ease of access for that. The other areas that we found were very concerning and also had a lot of questions regarding in our lived experience group was the changes made to self-direction and the day-to-day administrative hours. We don't believe that the 10-hour a month limit is appropriate for many of our members, considering what some of them need physically from their caregivers at any point in time. So to expect them to be able to accomplish all their tasks without day-to-day or remote hours is a problem for a lot of our members. And the other area that we would like to see changes in are in regards to IFDGS. There are already there were already problems with that service before the amendment, and since the amendment, those services became more difficult to access. And we would like to see a push towards not forcing our people with developmental disabilities to constantly have to prove just how disabled and just how poor they are to receive services. We would like to see a movement towards, if we qualify for services and if it is in the budget, we do not want to continue proving just how poor we are. It is a problem on many levels, and that is one of the bigger grand changes that we would like to see in these kinds of systems.
Thank you, Charlotte. We have Josh next.
So I recently ran into a situation where I almost lost my DDA waiver services because my service provider made a mistake financially, and I was able to get it resolved because I had family support and I was able to get a good lawyer who's experienced in that situation. And I don't want to see other people go through that process without any support or having to go out and find support to have into that process. So I would suggest that maybe there could be a service or a system that would assist people in that situation resolve their issue.
Thank you, Josh. So have someone that would support people in resolving legal issues, eligibility issues?
Yes,
Could you give us a
regarding
little
their
bit?
DDA waiver services. Yes, Rhonda.
And to also add on to what Joshua is saying, because yes, we definitely need someone to help with those services, but we'd also like to see a reduction in instances of this happening, because what ends up happening is not only is DDA spending time and money fixing this issue, but usually what a lot of these people with developmental disabilities end up experiencing is at the end, they just go, oh, sorry, my bad, it's all good now. But we fought it for weeks or months sometimes, and it just feels like we're fighting a fight, and then at the end, it's very anticlimactic. It's just, oh, sorry, that wasn't supposed to happen, or it's and there's no promise that it won't happen again. And so I think seeing an area where we have systems in place, like Joshua said, to help people that do come across those issues, and to see a reduction in them happening.
Great, thank you. Rhonda? Hey, yeah, Dominique.
What is the IFDGS thing that you guys were all talking about? I don't know. I have no idea.
That's a great question. Thank you so much for sharing that. So just to make sure I heard correctly, you're asking what is IFDGS that we're talking about?
Yeah.
Right. So IFDGS is really a short acronym. It's a short way of saying a longer service name that's called Individual and Family Directed Goods and Services. And so this service is a service that's available only under our self-directed service delivery model. And this service supports people who are self-directing to utilize some of their budget to purchase what we call goods and services that Medicaid typically does not pay for or cover. Okay, and so in this service, there are three kind of categories that I would say. One of them is called recruitment and advertisement. And so there are $500 that people can have in their budget to help them to recruit and advertise for staff that they want to hire. The second area is kind of what we would call general goods and services. And with the legislation and budget that was passed last year, that made a change to it that says that people could use up to $5,000 per plan year, so on an annual basis, to purchase some other goods and services. And those are kind of noted in the waiver program in terms of what those are and any limitations. The last area was another new category that we added with the amendment, again, based on legislation in the budget bill from last year, that included what we call day-to-day administrative supports. And that was some of the things that we've heard from a couple of the council members today, sharing some concerns related to that. And that provides up to 10 hours a month to support individuals that may have a need for help with coordinating their medical appointments and some kind of household management type of things. And so that's what we're talking about in terms of individual and family directed goods and services.
Okay, so they just withdraw what you were saying, and I wanted to be a good council member, so I asked.
Yeah, no, I think that's great. And I think that we need to continue to ask those questions, all of us, just so that we're all on the same page.
Okay.
Thank you, yes. Any other? Yes, Karen.
So the advisory council asked specifically, and we talked about it again this week, has there been an impact? And we would like to know if DDA is number one, collecting data, or number two, if you are hearing from people about the impact of the $5,000 cap to access these services. That, if we could get that information, that would help us to understand what the impact is. And as Charlotte, Charlotte's uses self-direction, so if Charlotte says it impacts me this way, we've got some feedback about, one person, right?
Correct.
But we want to know, as an advisory committee, is there a trend that you're hearing in regards to what the impact of that $5,000 cap is?
Yeah, so I would say a couple things related to that. In terms of impact and collecting data, the department is required to do joint chairman reports. So these are reports, Dominique and other people in the room, that the legislator will ask us to do related to certain topics. And so we do report out on our community services and number of people being supported. And there's a joint chairman report, or this special report that's specific to cost containment strategies that were asked to be implemented. And so the department has issued a report, and I believe we may be doing that on a quarterly basis based on the statute. And I see Rachel saying she thinks that's true. In terms of the $5,000 cap, a couple things just to note is that with the waiver amendment, we provided what we would call a glide path or a transition plan. And what that means is we said, anybody that was already approved for individuals and family directed goods and services above that new $5,000 limit, you can continue to access that through the end of your plan year. And then anybody new that was requesting those services or with the annual plan, then that would need to comply with the new amendment standards. And so that's what was put in the amendment and approved by the federal government. So given that, in terms of really looking at some of the data and the costs, we're gonna have to be looking and engaging that. But because the majority of our plans are usually done in July, there's going to be a delay in terms of some of the data and the impacts related to that. But we will take that back in addition to the joint chairman report that we have to do and look at other, information or tools that we can share. Andy.
Hi, two things. One is in amendment impact areas, if we could look at respite and how that might be affecting families being able to access respite, that the training was increased for people who access that service from providers, because now there's a ton more training that a caregiver would have to deliver respite. And I think that's going to be tough for people. And I had another thing. Talking to families about the impact of the LIST program going to being cut so significantly, and I know that was a General Assembly thing, but also going to the one time a year random lottery has been really difficult for families as well.
Greatly, thank you for sharing that. I know that we have Nova Evans and Janet Furman in the room with us, who the Low Intensity Support Services Program, or LISS, or LIST, as Andy was talking about, is under their purview. It's not part of the waiver program, so it's not part of this council, but we have that information, and I know Janet and Nova are appreciative of you sharing that.
Thank you.
Patty.
Hi, Rhonda, we had this conversation the other day about the glide path and some of the amendments or elements in there, and I articulated to you at that time that for people who self-direct, that have the money in their budget to use day-to-day administrator, there's that glide path until their next PCP, but for many people, it's going to be too late. because they can anticipate what the problems are going to be, and how can we avoid them having to experience the problem before it is seen as an impact by the DDA. So I'd suggest that we find a way to study that prior to the actual July 1 or even April 1, so we can project some impact, because once it's denied in their upcoming PCP, it'll be too late.
Yeah. Thank you, Patty. And I know during that conversation, we talked about really teaming up and partnering to look at a couple situations so that we could look at those impacts and anticipate that. So look forward to further discussions with you. Karen.
So I have the notes from the waiver subcommittee, so I don't need to be hogging the floor here, but these are the things that they asked about the amendment impact areas. And the next thing we talked about was nurses in regards to self-direction. I'm not the expert. I'm just going to read what the committee asked for. There is an expert in the room who could jump in if I'm not doing this right. So one of the questions to understand the impact of the waiver changes is, how many people in self-direction have an HRST score of 3 or above, meaning they would need nursing? Do we know that data? Second question is, how many nurses were working in self-direction in FY25 Q1 and Q2? Oh, in FY25 and in Q1 and Q2 of 26, because we understand that that's when the regulation is coming into place in January, that nurses have to be vendors. And we're trying to weigh the impact of this new requirement on how the availability of nurses to support people in self-direction. I think the worry was, again, not the expert, but there is one in the room. The worry was that the need was going to outweigh capacity, and how is DDA measuring that? And what will the response be? That's a systems question. What will the response be if there is more need than there is certified vendors, or whatever? Is certified the right word? Am I using the right word?
I think it's going to be Medicaid. We have to enroll in Medicaid.
Right. Medicaid vendors.
Right.
Medicaid providers.
Yeah. So that was a real concern. And their thought was the way to do that was to look at what the number of nurses that were coming in. I guess you could get that from your RF, the resource, the funding people.
The financial management.
The financial management people. You could get that number from them for last year, and then compare it to the number of people who are enrolled in ePrep, which means they've gone through the whole process successfully and are now vendors. And so they're wanting to compare the two to make sure that the capacity wasn't diminished beyond the point where people's needs won't be met. Am I right? Yeah. Okay, so that was one. And the same thing was true for behavior supports as well. The people who were receiving behavior supports, what was that number in FY26 and Q1 or 25 and Q1 and Q2 of 26 versus the number that will be vendors that have gone through ePrep. And that one might be more difficult because people could actually use providers for that one. They can use already licensed providers for that.
Right.
Yeah.
Mm-hmm. Yeah, and that would be the case for nursing too.
Oh, okay.
People self-directing can hire a DDA provider, or they could use vendors that now will be Medicaid providers.
It would lead me to the question of, did you do any review of the current providers and their capacity to rent out their nurse for these kinds of services? Because that would have been a really good preemptive look, I think, because you're not coming near any of mine. So I think that would be very good for DDA to know what the current capacity is and can it meet what the current need is. So I think there is concern that the current capacity will not meet the current need.
Okay.
And that's a waiver.
Do you have any other ones, Karen?
We talked about your last one, which is the assessment tool.
Okay.
I think we talked about the use of the current HRST behavior plans and nursing care plans. Alternative assessment methods or documentation should be explored to ensure a more holistic evaluation of a person's needs. So no, we wondered what you were thinking around the assessment tools. If there's any that you were looking at that you would suggest we also take a look at. And then finally, what is the date for, do you have a date for a future amendment that is a goal right now?
No, we do not.
Okay. I think that's it. Anybody else that was on that call? Beth, I'm looking straight at you.
No, I think you got it all.
Okay.
So Karen, thank you for sharing that. In the email that I received, it did have the assessment information, but didn't have the level of details related for the nursing and BSS. So if you could send that to Nicole and I and Charlotte, just so that we have that and make sure we have that information so that we could look at that. And then, you know, we
That's
can look
exactly what we did, is we took the email that we had sent you because we hadn't heard back, and we went into detail about specifically what we were looking for.
Great, thank you.
So I can type that up and get that to you.
Perfect. Laura.
Thank you. Karen's comments actually made me think about, and I don't know where it fits. It got raised a little bit in the mid-sec, but kind of for different, maybe different purposes. I'm not sure, but in looking at all of that, also kind of equity between, you know, assessments and approval of levels of support, kind of equity and implementation, both between regions and between the two provider model. I'm sorry, the two models, providers and self-direction.
Thank you. Thank you for all that discussion and input and advice. Let's go to the next slide, please. So we wanted to touch on service delivery and access to services. Can you go to the next slide, please? And the why we're talking about this is to improve service delivery and access to services. And now I'm happy to turn it over to Janet Furman, who is with our Cross Systems Innovations, and is going to share some information about the life support services. Next slide, please.
Hi, everybody. I'm Janet Furman. The Developmental Disabilities Administration has combined the Children's Services and Family Supports teams into a single initiative now called Lifespan Support and Services. This effort is going to bring together resources and expertise from both programs to provide a more coordinated person and family-centered support for children and adults with intellectual and developmental disabilities, as well as their families. The unified approach will guide targeted initiatives to strengthen early intervention, access, expand outreach, and enhance service delivery from childhood through adulthood. Next slide, please. Our team is defining families in a broad way. We're not only looking at birth and biological families, but we're also looking at families of choice, including friends and chosen people who may offer support and caregiving. Next slide, please. So Karen mentioned the charting the life course trajectory, and yes, we are looking at that in what we're doing, and it is there. Our vision is really to support children, youth, and adults with disabilities across the lifespan so that they can achieve self-determination, meaningful connections, productivity, and inclusion in communities of their choice. We want to ensure a sense of belonging and purpose in every aspect of life. We also want to empower families across the lifespan by enhancing their capabilities, recognizing their strengths and their unique abilities, fostering resilience, and providing the support they need to nurture and support children, youth, and adults, including those that are aging, to live their best lives. Next slide, please. Our mission is to support families caring for children, youth, and those who are aging by providing proactive, comprehensive, coordinated, and integrative support and services, as well as essential resources and strong community connections. We want to empower all Marylanders with intellectual and developmental disabilities and their families through a family-centered approach to build on their strengths, promote self-determination, and create inclusive, supportive environments where everyone can thrive. Next slide, please. These are our contacts for the current team, and I just want to summarize a little bit about what they do. The team works to improve access, support, and services for Marylanders and their families from childhood through adulthood. We build partnerships with individuals, families, providers, advocacy groups, statewide organizations to provide input to inform DDA's policies. We develop and work to ensure that DDA policies are person and family centered. And our key initiatives include children's crisis and hospital overstay support, low intensity support services, the Maryland Community of Practice for supporting families leadership team, and we support regional office staff in working with children, youth, adults, and their families. Next slide, please.
Charlotte, would you like to facilitate discussions and questions?
Absolutely. If anyone has any thoughts or ideas or questions about what's been said,
Hey, Karen, I have a question. So I'm always confused about this idea of young adults that make the choice to leave the school system before the age of 21. Maybe the school system isn't serving them well, and I remember that Bertie felt really strongly that if young adults decide to leave the school system and go into work, rather than stay in school because school isn't serving them well, that they should have access to the same services transitioning youth have. And so they're 19 years old, and in some school systems, people who are 19, 20, 21-year-olds are in rooms with 14-year-olds, and they don't feel comfortable anymore. And they want to get out and work and go to college, or whatever it is that they're doing. What access do those young adults have through the waiver, and how do they get access?
Sure. We have one waiver program, and so it's based on slots and availability. The slots are noted, some are as reserved categories, and so we prioritize people in crisis, emergency situations. We have people leaving institutions that are also a priority related to that. And then there are other, a variety of other categories that are in the approved waiver program. And so we would prioritize as per our statute and regulations, people in the highest need, which would be crisis resolution. As an employment first state, we absolutely want to continue to support employment for people. And from that perspective, we know that there are different services and paths that people go to. Some are seeking post-secondary education, some are seeking employment, some are seeking other services and supports. And so, as Janet said, and in general, we would want to support those situations. We do not have a reserved category for 18-year-olds that are seeking employment in the waiver. If that's something that the waiver recommendation work group would like to propose or other strategies, that could be something that could be proposed and go forward. But we would absolutely want to look and support that. I would say the other thing from the other groups, other advisory groups, they are looking at, how additional supports or partnership could be with the Maryland State Department of Education in terms of supporting individuals to be employed coming out of school. And we would hope that that would be regardless of age. And so I think there are things related to that the variety of groups are looking at, and there have been recommendations and discussions related to that. Emily has her hand up. So Emily, did you want to share your thoughts about this topic? And Emily, you'll need to unmute yourself. There may be a challenge that Emily's having. So Emily, if you're able to unmute, just let us know and we'll pause.
Yes, can you all hear me?
Yes, we can, Emily.
Okay. So I have a question. So I'm working with my fiscal manager. I'm working with my fiscal manager, but it's not going well. So updates on the waiver should be shared with them.
Thank you, Emily. We'll share that with them.
Okay, thank you.
I would like to just quickly, sorry, this is Charlotte, echo the confusion surrounding the facts and information about things is common, in that we see it kind of across the board with people's support workers, service coordinators, families, lots of confusion.
Thank you, Charlotte. Any other thoughts or discussions on the lifespan supports and services that Janet shared? Yes, Patty.
Hi, yes, so I've been out of the under 21 life for a long time now, so, but I know that people who self-direct that have minors are having a lot of questions, and when I'm looking at the vision and the mission of what you've put forth here, Jen, they're not feeling it. So what's the relationship between this department with children and services and people who are being served by the waiver and their minors? And I should know, I just don't know the relationship there.
So the CCS is the lead in working with the person. And the CCS then work with the regional office, and our team can work with the regional office as well, and often with the CCS to try to help to facilitate questions. And
so parents that are have minor children that are receiving waiver services are not feeling like the department is family centered, or they feel under attack. So how do we take this vision and mission of what is here?
We are implementing our vision and mission, and we'll be moving forward. We just did this a few months ago. We developed all of this, and so we are working within DDA to move forward.
I don't mean to put you on the, that's not what I'm asking. Help me understand, is what you're talking about apply to
it applies to everybody.
To all people that are under 20.
To all people.
Regardless of whether they're receiving waiver services or
all people.
Okay. Yep. So could I make a recommendation that you just reach out to some of those families in some way that are families of minors that are in waiver services. And of course, I only come in contact with those that are self-directed, but they could use some attention. That's all I'm asking.
Yep, yep.
Okay, let's go to the next slide. So we wanted to talk about federal waiver requirements, another part of the council's purpose. Eric, if you go to the next slide. And as we shared in past meetings, the Federal Center for Medicare and Medicaid Services, which is the government department that we work with, requires us to follow certain rules, and they call those assurances. And this is to make sure that the programs are run correctly and that participants are safe and supported. So we're going to go to the next slide. Do you want to share these? Well, sure. Go ahead.
So this slide is the federal assurances. So as we've shared in the previous meetings, DDA is required to report out on all of these performance measures. We send a quarterly report to the Office of Long-Term Supports and Services, who in turn send a report to CMS. So we've listed it out. They are the administrative authority, level of care, qualified providers, service plan, health and welfare, and financial accountability. We've also provided just a brief, like not one pager, but a document here that lists out all the performance measures related to the assurances and the data source of where we get some of this data from. So just a handy resource, this will be, if it's not up on our website currently, it will be on our DDA Waiver Advisory Council website under resources for future reference.
And just a reminder, each meeting, we've been going through the different assurances and highlighting them. And we received an email from the council member that asked us to talk about some of the areas of non-compliance. And so we have been talking about those, but we wanted to bring that back and review some of the information that was previously shared and have some discussions. Move to the next slide, Eric.
All right, so as Rhonda had shared, there was a request to talk about the non-compliant performance measures. Just to reiterate, DDA was compliant in all performance measures except for the qualified providers performance measures. So we've listed the non-compliant qualified providers performance measure on the slide, and those are in reference to ultimately it's in regards to the providers not submitting their applications prior to their expiration date, 60 days prior, and that is a COMAR requirement. So that has been the biggest trend. So that's related to licensed and certified providers, which also ultimately affects the training performance measures also. Again, DDA needs to meet an 86% threshold of compliance. So we fell below that. Because we fell below that 86% threshold, we need to develop a remediation strategy. If some of you remember a few meetings ago, Janet came and shared what that remediation strategy is. Again, we have a one-pager related to the remediation strategy available for council members. Again, this will be on our website for future reference also. Can we go to the next slide, please? Yeah, can you go to the next one too, Eric? Sorry. I talked through all those. Okay, so this again is the same chart that we shared previously. On these graphs, you can see hopefully you can see the red dotted line is the threshold in which DDA should meet that 86% compliance rate. The green line is related to the family supports waiver. We were 100% compliant with that waiver requirement. And then you can see the community supports waiver is in orange, and that fell below that threshold. I believe the annual percentage, I believe we have documented 65.2%. And then our blue line is the community pathways waiver. And again, you can see below the threshold, and then it went up. The reason why it went up is because that's when we transition to providers going through that 3-year renewal process. So that's why that spiked up. So again, the annual percentage was 72.3% compliance for that.
Could I ask a favor in the light of wanting to use plain language? What is 89% remediation or 89, what does that mean for people to understand?
Yeah, thank you. So remediation, I'm talking about, DDA needs to develop a plan on how to become compliant. How are we going to meet above that 86% threshold? We need to continue to monitor what that plan may be. So we work with our regional offices, we work with different partners within our headquarters office to ensure that we're continuing to oversee that and meet our compliance.
So you're saying that some providers have not followed the rules that DDA set out, and because of that, that DDA can get in trouble. And so DDA is going to help those providers so that not only the provider does it the way they're supposed to, but DDA doesn't get in trouble.
Correct.
Okay.
Thank you.
You're welcome.
Thank you for that. Any other questions? All right, next slide.
So these are just the resource slide that shows and gives the links to the 2 documents that Nicole talked about that we've got handout here, and then the COMAR, or the Maryland regulations, that requires providers to submit their application 60 days before. We'll go to the next slide. Charlotte, do you want to facilitate the discussion?
Yes, for anyone that has any questions or thoughts or ideas about any advice or recommendation on how we can improve compliance and or communicate requirements.
And again, we know we had shared Janet had shared the strategy before, but we've got the handout, and the council, please absolutely take this. We can further, have input and discussion as we kind of go forward, but these were the strategies that we had shared.
Could I pose a question to the providers in particular?
Go ahead, Charlotte.
Are there obstacles or issues that they have experienced in their attempts to become compliant, but maybe through things that were not faults of their own, that were happening whether in the system or technical issues or anything like that?
Yeah, so Charlotte, remember when Patty was talking earlier about how difficult it is to get through the e-prep system for the nurses? The same barriers exist for providers. I got a phone call from Marlena the day ours was due last year saying, you got to get this done, right? Because you're trying to get this happening. And I said, I'd love to get it done. They said that they needed to reset our password. We've been calling them every day for the last 3 weeks to get our password, and they never sent it. And they said they will send it. So the system that DDA uses for the providers to log into to complete this application doesn't always work smoothly. And just like I think somebody said earlier, that it would be great if DDA had a person that they could go to help them if the redetermination for medical waiver. There was not an easily identified person at DDA who could help us with this, because what we're experiencing problems with is not a DDA issue, it's a Medicaid issue, which is it's of the department that DDA works under. And so the systems don't always work really well together. And there isn't always a human being to talk to solve these issues. And there might be some people who just don't even know they're supposed to do it. That might be happening too. But on our situation, the system, the technology system is clunky and doesn't work well.
Yeah, just a quick response to that. I know we have Jamie and Laura on the line. Just to clarify, the performance measure that we're talking about is the actual DDA application to be submitted. It's not the revalidation through the e-prep process. So Karen, I appreciate what you're sharing in terms of those challenges, and I know Janet and Nova are here who have provider services, so they'll take that back. But that's not the indicator for this performance measure related to that, but we're happy to look at the e-prep challenges from that. This is the recertification annual DDA application that's outside of the e-prep process. We have Jamie and Laura. Jamie? Jamie, you need to unmute yourself.
Can you hear me now?
Yes, we can. Thank you.
Okay, sorry about that. For recommendations regarding the application and the timeliness of that, one clarifying question, is that strictly that it was submitted or that it was submitted in its entirety? So if you needed to get additional information, but it was submitted, is that counted as it was on time or not?
I believe it is when they actually submit the full application.
Correct. So if someone submitted it thinking that it was complete and you needed additional information, would that be outstanding until you got the additional information?
I believe the regulation says that the application has to be submitted 60 days prior, but we'll go back and confirm that and be able to share additional information. But I think the Comar regulation says it has to be submitted 60 days before. We do have some providers that are submitting it days late or even later. So really it's that 60-day requirement. And so you've seen through our quality improvement strategy, strategies that we're doing to include 120 days before that even due date, actions that are being taken and leading up to it. And so we're hoping with the quality improvement strategy that's in the amendment that we had shared, that Janet reported on, will help us to further support our providers in terms of getting it in and meeting those compliance of the regulation.
Thank you for that. I think the reason I asked that is because I think there may be an opportunity to look at the application and associated checklists and tools that are given to providers to ensure that when they submit, they're including everything that they need to get that process to be more efficient and effective. And Nova, I know you and I started talking about this the other day. I think there's an opportunity to maybe get a subgroup to work on that or to give further recommendations about how it could be more clear.
Thank you, Jamie. Laura?
Thanks, Rhonda. So I just wanted to say two things. One, well, first of all, I'm really interested in working on behalf of Max with, you know, our members on this issue. We have started having online meetings with members every 2 weeks. And so this has actually been on kind of my tickler list of something I'd like to talk in those meetings about, and would, you know, certainly like to partner with DDA around this. But I do know that providers have reported for the last number of years kind of their frustration in submitting all the licensing documents, and it kind of sitting for months and then getting asked for updates, like updated. So they submitted a training record, you know, a roster, and then, you know, a few months go by and then they're asked to update it, and then a few more months go by and they're asked to update it again. And what I don't know is how those initial applications that were complete, submitted on time and complete, if they were counted. I would assume they were counted as being submitted on time, but given that we know in EDD there have been, you know, issues with applications being received and not being acknowledged as being received when they were, I don't know what the answer to that is. Yeah, and then the other thing was just, you know, I would love to, you know, we can read a lot of members, certainly not all of the providers, but a lot of members to try to help with this. So. That was it. Thanks.
Thank you. Rob?
Yeah, I was gonna say the exact same thing. As a licensed provider, I guess I'm curious though, is this submission of the materials or is this submission and approval of the materials? Because I know, like my renewal date for my organization was in May. So we would submit our information in March and the certification would come back without any issues. But when it has to go to OHCQ for the licensure, that's what takes significantly longer. And so I don't know if that impacts the time frame or if that's what we're talking about. But then also I know Rachel has a.
Yeah, I pulled up the regulation, so that might be helpful. It says that you have to file your application for a license or renewal on the form at least 60 days before expiration of your existing one. That's it. And then it says your license won't expire until a decision is made or an action is taken on that renewal. So my interpretation of that would be that the license provider submitting renewal application is solely about submitting it 60 days prior to the date. However, your license doesn't actually expire on that date, and that gives the state time for that back and forth without having to deal with a quality issue. I don't know how to.
Sure.
Yeah.
Yeah, so submission, and providers are not getting them in 60 days before.
So it's solely.
But we have quality improvement strategies, and I know Nova and Janet are here, and they're going to continue to support providers and work through those processes.
Can I just add one more thing, just in response to what Rachel just said, if it's okay? I just want to say, I do know that providers, even though it is true, it's kind of an evergreen licensing process. If you get your application in, it's the license is still good until there is a determination. But I do know that because of how much more complicated everything has gotten between particularly with ePrep, there have been issues with even though the license is technically evergreen, the delay in review and official approval has created complications. I believe in ePrep, some of the providers may know more specifically better, but so that does create, it used to be simpler, but it's not as easy as it used to be.
Thank you. So time is clicking pretty quickly for us, and so I'd like to make a suggestion. We have additional topics related to the access rule. In our packet and on the slide deck, we have provided a visual that was created by the National Association of Developmental Disability Directors related to the access rule. It talks about the different provisions and the time frame for compliance related to it. It's important to note that with the new federal administration, information that the states have received so far is these efforts are going forward, but they are looking at different components of that. So we could get updates at any time. So we have that. Our Medicaid partners have been sharing information each meeting and going through the different provisions of that. And so we have some updates related to that in terms of payment adequacy and the 80-20 rule. Both of those, the payment adequacy reporting would be the kind of yellowish part here, which would come into play in July of 2028, and the 80-20 rule in terms of 2030. So they're not like right on us at this point. So we have that topic we can go through. We also have the updates related to our quality enhancement improvement strategy. So we have Liberty here, our quality improvement organization that can answer those additional questions we had related to the NCI. Why are we looking at participants and family surveys? Because we had some discussions about that before. So we can share some information about that. We have slides in there, you could see that. And then our future meetings, we plan to provide additional discussions and data elements specific to the participant surveys, which was the suggestion or the advice that we received from the council before. The presentation includes the link to the actual NCI survey data. So members can go on and look at that information and see the entire wealth of information about the various surveys. But our future meetings will include presentation, and we'll go through some varied topics and go through it slowly. So we have that information. We wanted to share some information specifically related to some of the concerns shared last meeting, specifically for the self-directed service delivery model in terms of a few things such as the health insurance requirements, reimbursement versus the financial management counseling service provider purchasing, and then something new that relates to a new legal requirement called MD saves that's impacting the people who are self-directing. So we wanted to share a little bit about that in terms of making the council aware and some of our next steps for that. And then we wanted to have further discussions about work groups. I think we've had some really great information and discussions in our different topics that we've talked about today, coming from people with lived experiences. Charlotte's been sharing and reporting out some of that. And Karen shared some information related to the recommendations when we were talking about that earlier. And we also wanted to share that we are seeking to create a new subgroup specific for self-directed services, and looking to see if there were any volunteers to help facilitate or co-chair that. So those are the things that are left to discuss, and then we wanted to open it up for public comment. I would like to suggest that we have Liberty and the access rule be moved to the next meeting. You have that information that you could see related to that and additional things. I would like to share the updates related to the health insurance reimbursement in Maryland Save, and then go into further discussions and dialogue from the other work groups with people with lived experiences and any additional things from the waiver recommendation group. So I put that on the table for discussion about how you would like to proceed. I am here and can be here, and we can go through all of this information, but wanted to be respectful of the council members' time. Is there any thoughts related to what you would like to do as we go forward? I agree with that. Okay, Beth agrees with that strategy. Any other council members? And just for the people in the audience and the people on online, just so people understand, because we're getting questions and things. The way the council works is we have council members have the dialogue and discussions. At the end of the meeting is when we open it up for public comment. So we will definitely do that. So Beth would like to go with that proposal. Anybody else would like to suggest anything differently? Okay. So a couple updates related to self-directed services and things that are going on related to that. So one of the things relates to health insurance. And so in the amendment, in the self-directed services manual, we talked about reasonable and customary benefits. And you may recall, we brought the manual to the council and asked the council to give us input on the manual related to benefits. For health insurance, we know that individuals have been offering health insurance to their employees. And so we were looking to establish reasonable and customary benefits for that. And the manual says that anybody that was offering benefits related to health insurance going forward would need to comply with the standards that are in the manual. The manual also stated that if anybody had a health insurance benefit that they were currently offering, that we would work with stakeholders and individuals to talk about the transition of those policies to align with the manual requirements and standards. As we work with our financial management and counseling services providers to learn more about the types of policies that are being reimbursed, we're finding that a variety of additional people are being covered for health insurance that are beyond the actual employees. And so from that perspective, we are looking to utilize like a reporting form or some document that would support the program compliance and integrity, so we know exactly what the policy is and who is being covered, so that we ensure we're not violating Medicaid rules and providing funding or reimbursement for health insurance that's beyond the actual employees of people self-directing. From that, we would like to continue to support that transition for the policies that are not in alignment, to include maybe covering other people, so that when those policies are renewed, to include open enrollment, that those standards would be applied, right? So we had said in our manual, any new policies going forward would need to be in compliance with that. So the two things that we're sharing today is that we are looking at having a form that we could use, so we will know what the policy and what the request is for who's being asked to be covered or reimbursed for the health insurance, so that we can have that going forward. And then again, as we had said in the amendment, in the manual, supporting that transition, so that anybody who had a policy that was not covered within the manual in different coverage areas, that would transition through the renewal of that policy and that open enrollment period. Let me tell you the second one and the third one, and then I'm happy to take some questions. The second item that we heard was related to reimbursement. And so the other thing that we've noted in the manual is that we really want to support people's access to services, and again, program integrity and safeguards, to ensure that people are able to access services and utilize the direct purchasing of the financial management and counseling service providers as their current status of an organized healthcare delivery system. What that means is that they're a designated provider, that they're able to purchase items and goods and services from non-Medicaid providers. And so as we look at the qualified providers and the waiver services, these types of providers have to ensure that the purchase of these things from non-Medicaid providers or employees that were designated do meet those standards. And so we had put out that the FMCSs, the financial management services, would be purchasing those things, and we would no longer do reimbursements. We updated that to note that we would be reimbursing employees for their training cost from that. So that was updated in the manual. And at the last meeting, we heard additional concerns about people being able to access services and maybe some of the challenges for the financial management providers to be able to purchase those items directly. So we have been looking at that, and with information that we've received from stakeholders that have come into us, and looking at providing maybe kind of the flexibility or hybrid related to reimbursement versus the direct purchase from the financial management and counseling service providers. Two particular areas that they noted as challenging in terms of the direct purchase related to things like the recruitment and advertisement for like care.com, and also transportation related to Uber and Lyft, and looking for those to be maybe continue in terms of a reimbursement strategy. We would want to, from program integrity and compliance, make sure that there's appropriate supporting documentation so that those items that are being purchased are for the participant, et cetera, from program compliance and auditing purposes. But looking at providing some additional flexibility related to some of the other services that could be through a reimbursement process. So we are following up with our financial management counseling services provider. We're going to talk about the items that we are looking to continue to have flexibility for reimbursement, and then those items for direct purchase from the FMCS. It's important to note that some of the reimbursement, or I would say from what I understand, the majority of the reimbursement are from family members that are actually putting money out ahead of time to purchase items. And we know that we want to support individuals to be able to access that and not put out their own money, not have financial hardship related to that. And we also know that there are some families that don't have the funds to be able to put it out ahead of time. That's the why we said really the financial management provider should be procuring and facilitating those purchases from that perspective. But given the input that we have received from a variety of council members and others, we want to look to see the additional flexibility we can have in terms of those reimbursement while still having our program compliance and safeguards. So we will provide additional information and communication updates as we work with our financial management. But we have heard, and that's why we are looking at those additional flexibilities. The third topic, just to share, is a new program called MD Saves, or Maryland Saves. And there was a legislation that was passed last year that was really looking to support Maryland workers in terms of retirement and being able to get retirement accounts or opportunities for things called like Roths or different. I'm trying to figure out how to share this with everybody. There are different things that employees could purchase or buy in or put their money in that could save and make money for future retirement is one way to say that. And so this program called MD or Maryland Saves that's come out, as we're looking at it, it is going to impact people self-directing services. They are viewed as employers by the state because they have an employer identification number, and they have been receiving letters from the state letting them know that they are, as an employer, have the opportunity to participate in this Maryland Saves program, which is at no cost to them if they choose to participate. And what it does is provides the opportunity for their employees to purchase retirement options, such as a Roth. There is no requirement for employer contributions, and as per the self-directed manual, retirement plan and contributions is not a benefit that's currently under the self-directed service program, but this would provide an opportunity for those employees of participating self-directing to buy into or utilize retirement opportunities there. The information that we have received is that registration with the Maryland Saves program is required by December 31st. And if individuals do not register or submit a request to waive that requirement, and you would waive that requirement because you're already providing retirement options, maybe through your own program or employer, because it applies to a variety of employers, then there will be a $300 fee charged to the participant. So what we're doing right now is we're working and looking with our department to see if we can request an extension to the requirement for our programs to support additional time, to support not only information and education for participants who are employers under the self-directed model, but to also provide time and opportunities to ensure we've got the operational structure that would be set up to support individuals in that process. So to summarize, health insurance, we're looking at that, looking at having a reporting form for compliance so we know exactly what's being asked to be reimbursed. And again, communicating the transition plan, which would be for any new policies that differ from for people who have it that are not compliant, to include the open enrollment process, reimbursement, looking at that to provide additional flexibility of that, but also wanting to ensure that our financial management providers are available and can purchase any of those items, because we don't want to have financial hardship and people trying to purchase things ahead of time or purchasing it and then getting reimbursed. And then the third thing relates to the Maryland Save program. So I know that was a lot, but we wanted to share this because it's one, important information and feedback we had received from people with lived experiences and others, and the importance of the Maryland Save and program coming up. So I'll pause there and take questions as best I can. Just note that, you know, we're looking at that to address, so I don't have all the answers for you today. Patty.
So just going to clarify on the FMS reimbursement for some items under IFDGS or training. You're telling me that employee training can be reimbursed as of now. And
Yes.
other things you're looking at with the FMS, the other things you're looking at flexibilities for other things not being directly. But if a person goes to the CPR and first aid and they're submitting there for reimbursement, that is currently able to be done.
Yes, that was the update that was made in the mail. Yes.
Hi, this is Charlotte. I have a question about the reimbursement.
Yes, go ahead, Charlotte.
Will the employee insurance reimbursement be allowed for employees who are on insurance plans with their spouses through another employer?
The,
Can they be reimbursed if it's not through Maryland Health Connection or a privately purchased insurance?
yeah, I would refer back to the self-directed services manual, which notes some exclusions in terms of different types of insurances related to that, but we're happy to look at that more. Again, the intent of the health insurance is for the employee. And so in those situations, we would need to look at what's the employee's cost versus the family reimbursement, which is what we're saying is that reimbursement is being sought for the entire policy that includes non-employees on that, which I do not believe was intended.
Right, but if it was solely for the portion of the employee or the staff of the participant, if their portion could be determined, could they get a reimbursement on a plan that they shared with their family?
Yeah, Charlotte, so we are looking for the reporting form so that we have more information to make informed decisions related to that.
Okay, thank you.
I would just add to that, I mean, the amount, the cost differential for somebody that is on a spouse's policy and it's very clear their name's on it and what their portion of the policy is to be reimbursed just for that employee versus that employee having to get a whole separate policy for themselves. It's so much more expensive, and that's what we're faced with doing. So that will just drive us.
And the data reporting form will help us to know, what is your policy? Oh, it's under this. Well, what's your share? What's the additional cost for additional family members? So we could seek that so that we're aware and that we ensure we're really providing reimbursement or payment for the appropriate. Yep, yeah. Oh, Abraham.
So, question on that: do you know when it will happen, though?
Yeah, for all these things, Abraham, we would be looking to share some communication, the reporting form out so that we can gather that information. We would be reminding individuals about the manual, which says what the benefit options are, and then letting them know that really the transition would be with their policy renewal and open enrollment. And again, reinforcing that any new policies that would be, or any new benefits for new policies as it currently states needs to be in compliance. I hope that was helpful, but we wanted to make sure that you heard from us and that we have heard from you, and we took that back and wanted to give you those important updates as we go forward. And so now, if we could go to the work groups, as I mentioned, we're going to add a new self-directed one, but we wanted to open it up to people with lived experiences to see if there's any additional information that you would like to share. Really appreciate all the input that's been shared during this meeting already on the various topics. Charlotte, did you want to share anything additional?
Sure. One of the requests and things that did actually topic that did come up today was in regards to employee benefits. We would like to make sure that the participants, the individual with developmental disabilities, have the ability to utilize their funds to the best of their abilities. So we want to make sure that they can make their positions as desirable as possible for the public. So we need to make sure that things such as paid time off for part-time employees stays accessible if it is within the the individual's budget, because those are the kinds of things that ensures that they can not only find staff, but keep staff. So removing things like insurance benefits or PTO or anything like that from any staff that is not full-time needs to stay accessible. It is important not only to meet retaining staff, but also to the safety of the individuals with disabilities. We shouldn't have to force caregivers to make the choice between do they come into work sick or do they receive the funds of time to feed their family. And so we ask that any changes that were made in the amendment that could affect those areas be reassessed again by DDA and this council.
Thank you. Any discussions, questions for the people with lived experiences? We'll go to the waiver recommendation work group. I know Karen shared some information. Looks like people in the room are saying we're good. Okay. And then the new subgroup, which will be self-directed services work group. We talked about creating this group and opening it up for anybody, any council member that would like to volunteer to facilitate or chair this group. Patty.
I think that, within the work in the waiver recommendations sub-work group, we have often asked within that subgroup, could we, split off specific to models so we could do deep dive into some of our individual model-based issues. I don't know that we were asking either as that group or as SDAN when we came to you the other day for a subcommittee of the full waiver advisory council. I think we were thinking of it as part of being able to split in those models within the waiver recommendation work group. So we would not, so I guess I would have put it out to the waiver advisory council to how do people feel about that? But in order to really deep dive on some issues that are model specific, we don't want to sacrifice being involved in another work group to do that. But, currently the waiver subcommittee is meeting every Monday. Where the one thought that we were personally having is perhaps every other Monday we split out model specific and we come back together the odd Mondays and we share, so. Yeah, so anyway, it was not the intention, but I'm not wedded to it. It was not the intention of the suggestion that this council had a full subcommittee on self-direction.
Great, thank you for sharing that, Patty. I think a couple things. For the waiver recommendation work group, that work group was established to give recommendations on the waiver and amendments. Keep in mind that what we've talked about even today is more than just the waiver amendment and those things. There's an interplay, obviously there's a connection there, but that work group is really related to amendment recommendations, right, and input. We shared kind of the summary thing here, any additional new amendments, those type of things would come forward. The council members in general represent different groups, and you absolutely, and we encourage you to establish your own work groups or other meetings and groups outside of the council's kind of parameters to gather that input and come back. And so I know, Patty, when we had the conversation a little bit this week about some of the concerns that we had heard, that, you talked about getting input from the broader self-directed community, that it was outside of the self-directed advocacy network. We know we heard Dominique's going to be reaching out to the advocacy groups. And so that's really what can happen. And Dominique could have a work group and meeting with that would feed back to here. So we don't have to have work groups within the Waiver Advisory Council or split out or have separate meetings. I think you have the ability to do that now. But we do feel it's important that the waiver recommendation work group has that presence and information from both sides so that we can understand and build. But you can absolutely split out and do other things and feed back into that group, if that makes sense. So what I'm hearing you say, Patty, is the information and the request that we had heard, we may have misinterpreted that we may not need a separate work group just for self-direction. So I just want to clarify that and put that out to the council to see if there was any discussions about that, whether we should have a separate work group on self-directed services or utilize what Patty was saying and what we talked about. Thoughts or discussions on that?
Yeah.
And
I
if you can-
support the intent that Patty mentioned,
Okay.
where within the waiver subgroup, we kind of break off to get into the weeds about our specific models of service delivery, whether that be the community provider model or self-direction model. But we still stay together as that group to formulate recommendations for the Waiver Advisory Council. So it's really just sort of creating subgroups within the subgroup, subgroups.
Beth, I think you were saying something.
No, well, no, I agree with that. So I think it's just a matter of our subgroup, the recommendations work group, kind of, which Karen now leads, right? Karen leads.
And Charlotte.
Okay, so, is within that subgroup or within that work group is then perhaps every other week, like we alternate a whole group meeting and on the odd week or the week in between, we do our subgroups, then come back together and do subgroups. And invite everybody.
Yeah, we'll discuss the
Discuss within the work group.
But I do hear what you're saying, that is specific to waiver recommendations.
Right.
That there may be other issues that need to be discussed, and I would think that, we can look at that, figure that out. But it's not when we're running, but we could look at that, because you're right, I mean, it's targeted and specific.
So every topic that we talked about, and we talked about today a lot of information, the council purpose, as noted in Maryland law, we talked about that in the beginning. And so for those topics, that's where, and it's said in the statute, stakeholder engagement, where we're seeing each and asking each council member to engage with your representation. So you can have other subgroups outside the council, they're not affiliated with us, so that you get that input and come back. And the input would be on all the different topics we talked about. And then the waiver recommendation work group really is, the purpose of that is for recommendations on the waiver amendments and going forward with the stakeholder input that we've got. But we need input and discussion on all the other topics. So unless I hear any other objections, we will not create a new subgroup called self-directed services. Is there any other discussion related to that? I guess maybe, Charlotte, we need to take a vote. Does anybody want to make a motion related to that? About whether to create a self-directed work group or not, as noted here, as a separate one versus the discussion we just had.
Yeah, I think maybe we need to table it and talk to
Yeah, I
our
would make a
work
motion to
group.
table it for now, because if we can work it out within the subgroup, then we
Yeah.
don't need a separate work group within the council.
We just want to make sure everybody in the work group agrees to that approach.
Okay. And just keep in mind, the waiver recommendation work group is for the sole purpose of waiver recommendation.
Right.
And you can absolutely split out and do however you want to do that to feed that up to the DDA. Okay. So we'll table that till next meeting. Out of respect for the public that has been with us, I'd ask for your support in at least allowing some time for some public input. And so if you're on the phone or in the room and you'd like to offer a comment related to the meeting, we will now take that, a few of those. And again, we apologize for going over. So our first one is Ariel. Eric, if you could unmute Ariel Doris, Mike, and Ariel, please share one comment so that we're able to support other individuals.
Took me a minute. Sorry, folks. I was trying to get my mic off. I just wanted to follow on to the self-directed services work group. I think that y'all just decided is outside the scope of the waiver advisory group, and wanted to make a suggestion that there be a compromise avenue into the waiver advisory council. In other words, people with lived experiences are a priority in this group. And folks who are self-directing their services are lived experience individuals, whether they are waiver participants or waiver participant representatives, struggling to navigate a lot of frequent changes. And provided that there are constructive solutions being suggested, I understand there is not going to be a lot of time to field complaints, but constructive recommendations. Can there be time set aside in the work group? Not a huge amount of time, but let's just say 1 or 2 avenues, be that by email or be that in the meeting, where a representative like Patty can say, all right, here's what folks who are self-directing, here is their number one concern and recommendation related to this concern. Can you guys see a way to that?
Yeah, thank you for that comment. And I think that, Patty, as the Self-Directed Advocacy Network person who's sharing here, representing some of the self-directed side, and I know you had shared with us this week that you partner with a variety of groups. That would be something that we would hope that you would be doing some of these things and bringing those things to us as you have. So I would suggest that anybody, if you're okay, reach out to you and Stephanie as the representative to help to gather that input that comes to the council.
Thank you for taking my question.
Yep, thank you. Anybody else? Anybody else want to raise your hand so that we can take your question? Jessica? If you could unmute Jessica.
Hi, can you guys hear me?
Yes. Can you share your
great.
comment?
Sorry, I'll be brief. I had a quick question as it relates to the Charting the Life course framework and information. I think we kind of grazed over it pretty quickly, but I'm just curious. Is that framework, we've had a charter with Charting the Life course for quite some time, a few years actually, and I was just wondering if this initiative with like the children and families, is that something new that's getting like revamped? Or are we doing it in addition to what's already been required amongst like CCS agencies? I'm not quite sure I followed that.
Sure, Janet, you want to answer this question?
Sure, this is in addition to what is already happening. We're not changing anything that's currently happening. We are just trying to incorporate more of the support of families and people across the lifespan. So we will be enhancing things.
Okay.
If you have ideas, please feel free to share them.
Yeah,
Not now,
I think I'm a little confused, only because we've had that, but we haven't really utilized it. So I think it's great to hear that we're finally going to utilize it. Thank you.
Thank you. Anybody else online that would like to raise their hand and share a comment? Having seen no others, we really appreciate your time, especially staying with us for another 31 minutes. Great discussion and dialogue. So we look forward to meeting with you in December. So be on the lookout for information related to that. Reminder, if you need help with the appointments, please reach out to Nicole, and we're here to support you. So thank you, everybody. Have happy holidays.